Uh, Ji, Assalamu alaikum, everyone. Thank you all for being here. I know it's a particularly pressing time for the country, but this is an incredibly pressing topic that doesn't pertain to the elections, at least on the face of it. My name is Umair Javed. I'm the program manager and affiliate at the Consortium for Development Policy Research. I also teach politics at LUMS. We welcome you all to this Lahore Policy Exchange discussion on the Doing Good Index, which is an output that has been carried out by the Center for Asian Philanthropy. And to talk about philanthropy and obviously Pakistan's particular experience and its potential in philanthropy, we have two very illustrious speakers. We have Mehwish Mumtaz Ahmed, who is the Director of Research for the Center for Asian Philanthropy and Society based in Hong Kong. She used to work at the Poverty Reduction and Economic Management Unit at the World Bank and has also worked at the UNDP. She has degrees from the London School of Economics and Princeton University. And then immediately seated to my right is Dr. Faisal Sultan, who is the CEO and consultant physician at Shaukat Khanum Memorial Cancer Hospital and Research Center, which is obviously one of Pakistan's most renowned hospitals and one of its most renowned institution for philanthropic contributions. He has a postgraduate diploma from the American Board of Internal Medicine and Infectious Disease. So without taking too much of your time, I think we'll get right into the Doing Good Index, which Mehwish can sort of walk us through through a presentation. So Mehwish, over to you, please.
Okay. Thank you very much for that introduction. And thank you all for coming. And, despite what I'm sure is a bit of an esoteric title, I'm sure you were partially also wondering, what is this index? Why do we need it? What is philanthropy? And I'm hoping that I will be able to address some of those questions and introduce the index to you, which is based on 2 years of work. It's quite a dense piece of work, which I will make as non-academic as possible. It is not an academic piece of work, but hews quite closely to it. And I'll also, let me also tell you that, actually let me introduce the center that I work for. So it's called the Center for Asian Philanthropy and Society. What we are essentially is that we are a research institute that is based out of Hong Kong, but we are pan-Asian. So we look at all of Asia. And the Doing Good Index actually covers 15 economies in Asia. And I'll explain to you why we call it economies and not countries. China is to blame, but I'll explain why. So what we do is we look at all of Asia. We do two kinds of research. We do both policy research, which is government-facing, and applied research. This is our flagship policy research project. We will repeat the index every 2 years so that we can track how well countries are performing and what is changing. A lot is changing in Asia right now. Asia is truly in flux, and our economies are in flux, wealth creation is in flux, the middle class is growing. There's a lot of resources out there. At the same time, Asia is a continent that has persistent and great need. So the reason the center was set up was to argue for and to show that some of this need that persists in Asia can be met through philanthropy. And I'll again explain what philanthropy is and how it is different from charity. But our goal is both to increase the quality and the quantity of philanthropy across Asia, from South Asia to Southeast Asia, East Asia, North Asia, across Asia, with a goal of working with governments and private actors to meet these needs, to really take Asia out of the state where need exists to a state where most of society's needs are met. So that's broadly our goal, and the way we try to achieve it is by knowledge creation, by research, and then by talking about this research to people like you and presenting it all across Asia. So this index was launched, sorry, can we go on to the next? This index was launched earlier this year and has been presented globally. It has been covered in quite a lot of media. We've been invited to the World Bank to talk about it, but I feel like those are not the most important conversations that emerge from this. The important conversations are like the ones in this room, where what we talk about can be exchanged with your experiences, and your experiences can be fit into this and help inform the next round of the index. So these conversations are really the more important and critical ones. So thank you all for being here. Now, let me tell you a little bit about the index, but before that, preface this by saying that what is the difference between philanthropy and charity? How many of you have heard them used interchangeably? Have you heard of philanthropy being used separately from charity, or is it used interchangeably? I feel like it's usually used interchangeably, but there is a difference. Charity is me going on the street and finding that there's someone in need and giving them money, or me giving a donation that's one-off. Philanthropy is strategic, systematic giving. It is usually larger scale. Thanks to technology, the large-scale giving is not only now coming from high net worth individuals or institutions or CSR, corporate social responsibility contributions, but also through crowdfunding. So smaller individual donations are now, thanks to technology, they can be harnessed and contributed together. Now, why is philanthropy critical? Philanthropy is critical because the resources it unleashes, the sustained resources, can actually move the needle. It cannot replace government, neither can the private sector replace government. The government has its role, but philanthropy is a way of redistributing some of the wealth that is created in the private sector back towards public good, and it's strategic. So what we wanted to do with this index is we wanted to understand what is the philanthropic landscape in Asia, what is the infrastructure that encourages strategic, sustained, systematic giving, that basically encourages people to give a lot and give often. We also wanted to understand how philanthropists and the media and policymakers can be exposed to the levers that really best encourage giving. At the same time, we're looking at both the giving and the receiving of philanthropic donations. So we're looking at the infrastructure that encourages or discourages the flow, the cyclical flow of philanthropic donations. How easy is it for money to go in? How easy is it for that money to be received by the actors that need that money the most? But most importantly is the first reason here why we did this index. It's to better understand the trust deficit in Asia. Can we go to the next one and then come back to this? So, how many of you are aware of this trust deficit? Actually, let me poll the room quickly. How many of you work for nonprofits? How many of you work for companies or business, private sector? Okay. Government. All right. Okay, mostly nonprofits. I think we can all understand that the nonprofit sector, and this is true in Pakistan, it's true in America, it's true in the EU, it's true everywhere, has this strange reaction. It evokes this strange reaction in people where it is a matter of guilty until proven innocent. There is absolutely amazing work being done in this sector. It's being done by nonprofits, it's being done by social enterprises now, which are for-profits. It's also done in China and other parts of East Asia by government-affiliated nonprofits. There's a special term for it. It's called GONGOs, government-organized non-governmental organizations. That's an oxymoron if you ever heard one, but in China, even in Korea, in Japan, in Singapore, they're very, very popular, these kinds of things. So they're doing amazing work, but there are 5 reasons why this sector's reputation is constantly, it seems, under attack. It's constantly being weakened. Now, one is that the regulations surrounding this sector are murky and fluctuating. When the laws keep changing, it's hard to follow them, it's hard to understand them, and it's easy to say that they are not being followed. So that's one. And I'll talk more about this in the Pakistan, China, and India context. Secondly, this sector is prone to significant and highly public scandals now and then. The interesting thing, though, is that, and this is where I like to defend the sector, because the private sector has the same kinds of scandals, but no one sits up and says, let's do away with the private sector, let's do away with businesses, let's do away with the corporate sector. So there's something about this sector, and I think that's because it's viewed as, it's viewed as a higher calling. that the burden placed on this sector is, people are trusting them with their hard-earned money to meet a social good, and therefore the standards that the sector is held to are almost higher. So people feel almost personally betrayed by scandals. Although it's human nature, there will always be some fraud, there will always be some breaking the rules, but in this sector it hits particularly hard. Thirdly, the way the sector is organized, and when I'm saying all of this, I'm really speaking from an Asia-wide perspective. The way the sector is organized doesn't lend itself to dealing with the fallout from these kinds of scandals or from promoting itself very well. So there's a general lack of transparency. Organizations in the sector are not very good at reporting what they're doing. They're not very good at promoting what they're doing. They just do. Their organizations are so under-resourced that they just get up and do, and they don't think about the reputation and everything else that, say, a company would spend a big chunk of its budget doing, which is burnishing its reputation. Also, the sector is not very good at explaining and measuring results, although that is changing a little bit. Fourthly, there is an unclear distinction between advocacy and social delivery organizations. So when we look at this index, we look at, we don't call the organizations we look at NGOs because there are gongos. We don't call them non-profits because social enterprises are for-profits. We call them social delivery organizations because we're looking at organizations that are delivering an actual social service as opposed to advocacy. Advocacy and social delivery has no distinction in Asia, and we know that governments in Asia are very wary of advocacy organizations. So when some action or some reaction to an advocacy campaign, for example, is in the works, the entire sector gets painted with that same broad brushstroke. Everyone is affected, and I'll talk about this again. And lastly, there is a historic tendency for the best and the brightest, the most educated going into other fields, into government or into the private sector, into the military up until a certain time, up until a certain point. This again is changing. So a couple of good changes are sweeping, winds of change are sweeping the sector, but some of them are, they will take time for them to bear fruit. Can we go back? Now, how did we do this? We looked at 4 sets of indicators that explain how healthy this infrastructure for giving and receiving is. And what we want to do with this information is to help mitigate the trust deficit. If we can shed light on what's going on and what helps this sector and what holds it back, what makes it easy, what makes the flow of funding more transparent, more accountable, then we can mitigate the trust deficit and at the very least remove that as an excuse for people and institutions not giving more. Right. So the how I'll talk about again. Who did we do this with? We are a lean team. We are based in Hong Kong. We worked with 34 partnering organizations across 15 economies and at least 2 in an economy, and they are the ones who gathered the data for us. So we're basing this index on a survey of 1,516, almost 1,600 organizations across these 15 economies. We're averaging more than 100 surveys per country, and these are organizational surveys. Each survey had 145 questions. Only the CEO or the CFO could actually answer them because they had financial disclosures. So it was a pain to put it in a nutshell, but we did it. For comparison, ease of doing business actually averages about 60-something surveys per country. So we did 100 and something. We didn't know what we were getting into, by the way. We might have stuck to the ease of doing business standard, but now that we've done it, we're going to stick to this. So let's skip 2 forward. So what are the 4 pieces of the puzzle that the index is based on? And what I'm going to do is I'm going to give you a broad overview. I'll share some of the broad findings and talk a little bit about Pakistan. And then I urge you to actually download and read the full report, which is available on our website, and it's free if you want more detail, or come and talk to me. So the 4 pieces that make up the index, the 4 sub-indices are, we look at the tax and fiscal incentives for giving and for receiving. So this includes things like tax deductions for donations, whether social delivery organizations are tax exempt, etc. We look at the regulatory framework, and that is divided into indicators that look at how easy is it to receive funding from domestic sources as well as from foreign sources. It looks at accountability, what accountability mechanisms are built into this sector. Thirdly, how good is the level of communication between government and the sector? This is the communication of laws and understanding these laws. And finally, efficiency. And this part is closest to, for those of you who are familiar with the World Bank Ease of Doing Business Index, this is closest to that, the efficiency part, which is kind of an ease of operations of non-profit organizations. How much time does it take? Do you need lawyers to set up, or can you do it yourself? How expensive is it, etc. The third part is ecosystem, and we call this the juiciest part of our index, because this is where we look at what public perceptions are about organizations in this sector, how well do institutions interact with and recognize this organizations here, what's the talent gap, is there a talent gap, and yes, there's a massive talent gap, and what are the governance structures in this sector. And finally, this is the smallest part of the index is procurement, which is the government directly engaging with organizations in this sector and procuring their services, which both legitimizes them and it enhances their capacity and basically encourages their growth. So let's look at the results. 15 economies. So we found that these 15 economies cluster into 4 groups. We didn't publish a league table because the league table is not important. What's important is these 4 stages of development that eventually end up with a high performance on this index. What is a high performance on this index? A truly nurtured, free, transparent social sector where all the roadblocks to giving and receiving have been mitigated. And we found that economies range from those that are not doing enough, such as Indonesia and Myanmar, to those that are doing well, that includes Japan, Singapore, and Taiwan. I will point out here that we scored the index out of 5, and not a single economy scored over a 4. There should be a 5th group here doing excellent. No one has reached that potential yet. But let's talk about these 4 clusters and what they mean. So let's start with the economies that are not doing enough and what lands Indonesia and Myanmar there. How many of you here actually do any comparative work between Pakistan and other economies? Okay, not so much. So I can say anything and you'll believe me. Okay. All right, so Indonesia and Myanmar, this will not be a surprise to anyone. The reason they're not doing well is because they do not even have some of the very basic infrastructure in place that will encourage giving and receiving. So Indonesia, for example, does not offer any tax deductions for giving. Neither does it offer tax exemption to STOs. STOs are a stand-in for social delivery organizations, i.e. mostly non-profits, right? So no tax exemption. Myanmar is undergoing great political transition, and they again are lacking some of these basic tenets. They don't have they don't have tax deductions. They also don't have a lot of the laws and rules in place yet that can guide the sector. So that's why they're over there. Why are China, India, and Pakistan together, and why are they only doing okay? The reason these 3 countries cluster together is because the regulatory changes, sweeping new regulatory changes regarding this sector have been introduced in these 3 countries. And they have been introduced in both pertaining to local giving as well as to foreign giving. And we've noticed that there is, these laws are exerting both a push and a pull. They're pulling in different directions, actually. So there is uncertainty in these 3 countries. The sector and giving seems to be a little spooked. What are some of these laws? So in India, for example, there is the 2% CSR law, which is actually fabulous. It means that companies above a certain threshold have to donate 2% of their pre-tax profits to the social sector to encourage local giving. That's great. On the other hand, though, India's FCRA regulation really scrutinizes all kinds of foreign funding, and what that's doing is it is really stymieing and dampening foreign funding. Pakistan has similar regulation in the works. As far as I know, it has not been formally enacted, but it seems to be in some form being applied, and there is anecdotal evidence. Again, Hard evidence is very hard to find, but there is anecdotal evidence that foreign funding is also drying up in Pakistan. From the organizations that we surveyed, to give you a sense of what kind of an impact that can have, about, I think, two-thirds of the organizations in our Pakistan sample were receiving some sort of foreign funding. Also, they were dependent on this foreign funding for almost 40% of their budgets. So these kinds of regulations can really impact social delivery. We also found that in China, India, and Pakistan, the organizations that are most likely to receive foreign funding are those that are working in education and health. So the bottom line effect of these regulations can actually be quite serious. But we're still waiting to see what the overall effect is, because the government also is kind of not sure. And it's still trying to, governments across these three are, especially Pakistan, are still trying to figure out exactly how to do this. Now, China is similar. There is both an INGO law, which is an international NGO law, and a local charity law, with the local charity law being designed to encourage and make it easier for local charities to set up. But the INGO law trying to make it foreign funded operations much more accountable. And what's that doing is, again, it's slowing down the pace of work that's going on in these economies. So in these economies, we see regulations are murky. You know what I said about what causes the trust deficit? They're murky, they're changing. These economies also don't do well in the tax and fiscal incentives. They don't really offer adequate incentives. I'll talk about that in a bit. And their ecosystem performance is not great either. The economies that are doing better, most of Southeast Asia and a couple, and Hong Kong and Korea, they do fairly well on regulations. It's easy enough for an organization to set up and to operate. However, again, their tax incentives are lacking, and in ecosystem, they're all over the map. And you can see that in the actual report. There's a mixed performance over there. The economies that are doing well are actually checking the boxes when it comes to most things. It's easy, it's efficient for an organization to set up. It's easy for them to receive domestic money. It's easy for them to receive foreign money. There are transparency and accountability mechanisms in place, which can be improved, but they're there. Their tax incentives are great. Singapore has the highest rate of tax deduction in the world. It's 250%. For every dollar that you give to charity, $2.50 of your income is exempt from income tax. That's a pretty hefty incentive. Individuals, actually. We look at individuals. Corporates, we have the information. We had to exclude it because the Japanese have a formula instead of a number for the corporate rate of tax deduction. So in the next round, we hope to include corporate as well. But we have corporate rate of tax deduction almost always mirrors the rate of tax deduction for individuals. So they're very similar. And I'll share a table about this later. Actually, no, there's one more thing. Sorry, can we go back? There's one more thing. This slide is going to take us the longest because this is where I really want to discuss the overall findings with you. So this is about how these countries cluster, but we also have three broad findings. One of which is, and these are valid across Asia, one of these is that people are engaged, but policy needs to follow. And why do we know this? We know this because these countries, these economies' performance in the ecosystem sub-index is actually higher, better than all of the others. That means that corporations are engaging with the sector has good governance, institutions are being awarded, they're being recognized, etc. People are ready, there are national volunteering schemes, etc. But regulations and tax and fiscal policy is lagging behind. So people are out ahead, governments need to catch up. The second overall finding is that in Asia in particular, tax and fiscal incentives really matter. And the reason is there's an actual effect. So, look at Singapore's 250%. If that's the tax incentive being offered, that'll incentivize me to give more. But in Asia in particular, where businesses, non-profits tend to work in tandem with government, they don't like to butt heads with government. When the government says we are offering 100% rate of tax deduction, the signaling effect is very strong. Everyone gets the message that the government wants us to give more, so people are more likely to give more. And the third thing we found was that there seems to be no correlation between how well countries do on our index and either their level of development, their GDP per capita. There doesn't seem to be. It's mostly really in the hands of government how well countries perform on our index. So we found that resource-constrained countries with poor tax collection, for example, Vietnam, are still offering a 100% rate of tax deduction. I think Pakistan is 30% for individuals and 20% for corporates. So resource constraints should not stop governments from doing that. Okay, I'm already at 20 something, so I'm actually going to skip most of the rest. Can you keep going? I'll just stop here for a second. So to give you a sense of what sort of tax incentives are offered, Singapore tops the table at 250%. Pakistan is 30% for individuals, 20% for corporations. India is 50 for both, and Sri Lanka is 100 for both. What is different between Pakistan, India, and Sri Lanka, the other two South Asian countries that we cover, is that in Pakistan there is actually no income limit. So you can claim the tax deduction on 100% of your income, whereas the others do limit the income. So they limit the tax deduction and they limit the income. I won't go much more into that. Can we go to the Pakistan slides? Keep going. Yes. So let's talk briefly about Pakistan, and I'll hand over to you. Okay. So what's going on in Pakistan? Yes, regulations are in flux and they are confusing. One of our indicators was how easy is it to understand laws, and we found that in Pakistan, more than half of the organizations that we surveyed found these laws difficult to understand. That's higher than the Asia average. So in Pakistan, regulations are murkier than in Asia on average. I've shared this figure already with you, that 2/3 of organizations that we surveyed receive foreign funding. About 1/3 of their budget comes from foreign sources. We understand that money laundering and terrorism financing are real issues. We understand that. When the government, however, is reacting to these issues and paints the entire sector with one brushstroke, with one law, one regulation that makes it hard to receive money, all the many more organizations that are legitimately operating are equally harmed. So we're not saying that governments should not watch out for money laundering or terrorism financing, and Pakistan absolutely, especially needs to. What we're saying is have a nuanced approach and have a proactive approach rather than reactive. The government should think about how it sees the social sector. Is it a partner in development, or is it a thorn in its side? So that's something that, that the government should think about and plan regulations accordingly. The next one. The other reason Pakistan is not doing that well is I spoke about the tax incentives already, but also in ecosystem, Pakistan, compared to the other 14 economies, is somewhere in the middle. It does do well compared to South Asia, though. It does better than India. It does better than Sri Lanka. One of the reasons is that people don't feel that the level of individual giving in Pakistan is low. Only 54% said that the level of giving is low. 82% in India said that it's low. In Sri Lanka, 74% said that it's low. Although the index is not looking at the level of charitable giving, this does show, it's a roundabout way of indicating that generally in Pakistan, organizations feel that individuals give a lot of charity, which is something we all know. We give charity. In our communities, many efforts are being supported by charitable donations, so we know that. However, Pakistan, along with the rest of Asia, faces challenges when it comes to talent recruitment. 2/3 of organizations find it very hard to recruit talent and retain talent. And as long as there's a lot of churn, institution building is challenging. Also, most of you work for nonprofits, so you know that there's almost 13 laws that pertain to the nonprofit sector. You know that registration can occur at the provincial level or the local level or the national level, and never the twain shall meet, should you wish. So it's very confusing. Also, reporting requirements are constantly being shifted, especially for organizations that are receiving foreign funding. Pehle it was Economic Affairs Division, then Ministry of Finance, then what CBR, Central. So it's all confusing. Confusion means things don't get done. Confusion means that the trust deficit persists. So with that, I'm going to hand off. There's a lot more that I can say, so, but I'm hoping some of that will come out later. But please, if this is interesting, I do urge you to read the report or drop me an email. Thank you.
Thank you so much, Mavish. That was truly fascinating, and it really sort of ties together some of these, the broader issues that the entire region and sort of the on the 15 economies that we've discussed here sort of face with regards to philanthropic giving. I will now invite Dr. Faisal Sultan to talk about both his experience as the CEO of one of Pakistan's foremost hospitals that obviously also relies a lot on philanthropic giving, and especially tying it together with Mavish's work on how the regulatory environment in particular in Pakistan either sort of enables or inhibits institutional philanthropy from fulfilling its potential. So Dr. Saab, thank you.
A little bit of a difficult marriage between a very research-based and analytic presentation and sharing of thoughts to something that's a little bit more pedestrian. I don't mean in any bad way pedestrian, but something more earthy that way. Okay, so I have a slide set and I'll run through it and see if we do connect some of the thoughts that have been already shared. So, it isn't the philanthropic model of Pakistan, but I mean the model that we have followed. So I think it's a bit high-minded to just necessarily assume that that's the model. Okay, talk about things. So, our basis really was, it's based on an individual need. The hospital came about as a response and reaction to somebody's personal loss or grief. And whenever you talk to the founder, Mr. Khan, he says, well, it isn't that necessarily I was not getting or my mother wasn't getting cancer care. What I looked around and I said, look, how is everybody else meeting this need? How is actually the rest of Pakistan doing this? I can go and access care wherever I wish to, but how's the guy sitting next to me doing this? He often relates this interesting anecdote where a day laborer, essentially a daily wager, lost all heart and lost all faith in doing anything once he heard the next phase of treatment, which of course was well beyond his capability of paying. So it was in that setting that the institution came about. And really the story is, I think, well known to most of us. As we sit today on T minus a few hours of the election, I don't want to talk too much of that because it could be misconstrued. But the fact is that it started off really with the shade and look and feel almost of an election campaign or of a public outreach campaign. If you look at pictures from those days, they don't look terribly different from what we have been seeing lately. So what ended up happening is that a personal need got codified, got solidified into something tangible, and then it was, it got powered by somebody's individual recognition or charisma or integrity or reputation of delivering, and all those things put together, and so the institution came about. We fundamentally and centrally wish to have 3 or 4 things working for this institution. We could just run through some of these slides. Now, this is the story is really a story of the collective will. We can look at the individual data, and we do know that a lot of people give a lot of money. We can do it anecdotally, or we can do it systematically and through formal research. But more or less, it seems that a lot of people do give a lot of money individually and to a variety of causes. So if you could, so this is, that's Imran's mother in the center. She's Shaukat Khanum. She's the center of the story here. And I often, kid myself into thinking this is just a stock picture, but the gentleman with the sort of thick glasses, the white beard, I think it was somebody like him that had that look of despair when presented with the bill for cancer treatment. So going on, this is, dreaming about it and getting it to be done. Next one. And this is what I mean. I mean, the look and feel at that time also had a lot of public support. Next. And so the hospital got opened in December 1994. It was, and some focus onto the money specs. Look, the total project cost was $22 million at that time. And we spend 100 million every year today. So things have gotten exponentially increased, or you could even say out of hand in a certain way, but it's a different time. The scale and scope of things that we are doing is much bigger. We broke ground in April 91. The hospital got inaugurated in December 94, nearly a record time for a non-profit organization. Very importantly, and culturally also very important, was the fact that we set the culture of trying to keep the institution sort of flat and even for everyone that accessed it. So we got the ribbon cut by our first patient. We've actually continued that tradition for Peshawar and also going forward for Karachi. Next slide, please. So this is a fundamental mission. It's a bit wordy, but really what we wish to do is cancer care. That's the center of it all through modern methods. But you know, the centerpiece of this is access to the poor who otherwise could not afford to pay. And I think that's the crux of the matter here. Of course, education and research, you can't do modern medical care without it. Next one. So now, how did we get where we are? I don't know. There are a lot of paths that one could have chosen, but this is the one we did. Next one, please. So one of the most important bits that we thought got us here and has continued to get us further and further is the fact that we have been strengthening some of the fundamental brand attributes. And two things are very common, are very important at Shaukat Khanum. One is this equity or equality. And you know, I know one could argue what each means, but the fact is that at the most simplest level, once you're into the system, we would like to treat everybody the same. And we've been able to project this and convince people that, look, this is not only that we believe in it, but that we actually practice it. And this, I feel, that has been a very, very important part of what has continued to help us. Next slide, please. So, not only is it qualitatively similar, but we have numerical data, we have evidence to show that the large majority of people that get cancer care in the system get it free of cost. In fact, we put out this figure of 75%. To be perfectly honest, it's actually more than this. We claim less so that we are never actually accused of exaggerating, but this figure, for example, in the year 2017, shockingly, was 94%. So 94% of all cancer care in Shaukat Khanum in the year 2017 was either free or almost entirely free. And so if you were to use the entirely free measure, that would be in the high 80s. So and this I think has been one of the most consistent and important messages coming out from our organization, and our ability to raise funds for it has depended heavily on the fact that it's access to the poor. The next bit is about, can you move on the slide, please? The next bit is about high quality standards. Now, sometimes there is this impression, I guess, that if you're doing charity, for want of a better word, or philanthropy in a more systematic, larger way, it's okay to do it at a slightly lower standard. You know, if you're giving away food, okay, it's fine. You know, it can be somewhat tasteless and maybe not as safe. We've actually looked at it completely the other way, and we felt that it is very, very important. And in fact, people donate and people associate with your cause because you're delivering not only an equitable access to the poor, but also at a quality level that even the more discerning ones, the more demanding customer, if you will, meeting that standard. And we've done it through a number of different vehicles. Just very recently, we got our Joint Commission International Accreditation, which was big news for us. It was third hospital in Pakistan to get this. The first fully charitable or non-profit organization, although the first one is also not a profit, AKU. Then it was Shifa, which is a for-profit organization, and then Shaukat Khanum. So for us, all these ISO certifications and association with programs of the College of American Pathologists, outcomes research, HACCP is one of the food certification standards. You'd say, what does that have to do with the hospital? But at the end of the day, it is part and parcel of the total package of quality that you wish to do. So, and other means and mechanisms, and there are too many to list on, even a number of slides that we have indulged in to ensure that this high quality is delivered. And I think that's been a very important seller for us. This has been a really, really important aspect of what we do. Next one, please. The other thing was that people do get tired of giving. You know, we know this famous donor fatigue. We haven't seen it yet, by the way, at Shauq Khanum, but we do know it exists. It's out there, and somewhere or the other it's going to hit. And so therefore, we have constantly tried to ensure that we have sustainability built in. Now you look that back in the day, 95, 96, you know, almost the entire game was dependent on philanthropic giving, either zakat or donations. And with time, what we have tried to do is reduce that dependence to a fair bit. Now, hospital services shows 39. In fact, it's artificially low because donations in zakat for 2017 included directed donations for specific projects like the completion of Peshawar, and therefore, it's an artificially inflated number. In fact, if in a normal given year, this split between the red and the green is about 50-50. Next one. So again, we've always pushed ourselves. My slide set was, you know, largely put together by my marketing fundraising team. So they always remind me that we give them unreasonable targets, and they've just rephrased them saying ambitious targets. They call it ambitious here, but internally they're quite. But seriously, they're always happy to have this ambitious target, and the very fact that we always felt that you aim high and you get there. Strategic intent matters, and at every juncture, whether it was at the outset or starting Peshawar or then going forth for Karachi, we've always felt that sometimes dreaming the impossible does help, because it gets you there. And obviously you need to plan it out and all that, but aiming high does matter. And I think setting ambitious targets has helped us, not only just for fundraising, but also for you know, the program delivery itself. When we set out and we said, well, look, you know, we're going to do this thing this way in Pakistan, a lot of the medical establishment and the medical system within Pakistan said, oh, no, but you can't do it this way because, you know, it's not possible. And a lot of impossibilities with time have become quite the norm. And so that has really helped. Next one, please. I mentioned this. You know, it's not just the fact that we have, you know, our own revenue stream, the clinical revenue of 40 or 50%, whichever way you look at it. But we have always tried to look at both domestic funding. Now, obviously, 70% of, and this is a consistent figure. I don't know. We don't dial it in. This is the way the cookie crumbles. It's 70-30, almost always. And interestingly, whenever we measure an increase over the previous year, it's almost directly mirrored in the overseas domain as well. Most of the money that we get comes from the UK, the US, and the Gulf. So the rest is smaller numbers, but we're trying to increase that. So actually, through going through to other territories and domains, and as we've gone on, we've actually discovered how different, yet similar at times, are regulatory requirements of individual territories. Our own, I must say, was easier in a way, and it's actually getting the regulatory. I don't want to use the word quagmire, but I think to navigate this will require an increasing amount of effort, knowledge, and commitment to doing it. Otherwise, it's going to become very difficult for NPOs and NGOs to continue to receive money, especially overseas money. Okay, going forth. Again, you know, the people talk about endowments and this and that. In our case, we've made good profits through endowment. We've constantly fed the endowment from some of our surpluses within the organization, and yet we received ire. You know, you said guilty until proven otherwise, and we faced this 5 years ago, and it was part of really a quasi or an actual political attack. I don't know what to call it. We had this famous investment in one of the Gulf countries, and because of the subprime crisis in the US and its ripple effects on the Gulf, and a global slowdown in terms of the real estate market, the valuation of that investment went down, and of course we had to defend like nobody's business on why we had done it, and fortunately we were able to recover all the $3 million out of it. But And at that time, we actually looked around and looked at endowments elsewhere and what proportion of their endowments actually were in private equity or real estate or others, and how they had suffered through the years. Nevertheless, the bottom line is that we do have some money put away as an endowment. Next one. So, we've tried. We keep looking at various ways and means and channels of how easy or difficult it is to get money for us. As you correctly said, just because it's a large sum of money doesn't mean that you can't donate your little, 10 rupees or 5 rupees. It's just using technologies and getting out to people. I think getting the message out has really, really helped us. And for example, this Qurbani campaign, it's a very intense campaign. It takes a lot of efforts, a lot of hassle to get people to work on Eid day and second day of Eid, going away from taking your day off to actually working. And in relative terms, it brings in lesser money. But it's a very high profile, high visibility campaign for us, connects with us, to our donors to us, and therefore it really helps us. And we feel that, checking all these little boxes helps in putting together the big picture, which gets to be bigger every year and slightly scarier. Next one. Pretty much nearing the end now. We talked about attracting good HR. Well, that's a constant issue. And for a hospital that requires nurses and highly trained physicians and technical staff and others, this is the biggest problem that we face. And I've listed out a bunch of things that do work for us, but I think everyone here in the room faces this. You train a few people and off they go. All right, moving ahead, I think we're pretty much at the end of my slide sets. I'll be happy to, of course, discuss and talk about it. The other big challenge is this. You build something that is successful, and you give it away for free. So you're immediately, by definition, going to have a capacity issue. I always remind people, people come to our doorstep and they say, well, we've come with all these hopes and you're saying no, we will not accept you for treatment. And I always say, even something as ordinary as water or a slice of pizza, if you start giving it away free, you're bound to end up finishing your resource. So this balancing of the load that comes through to our door, and who to take, and how to then package this message, and how to get across to our donor and say, well, look, you're absolutely right. We do refuse, thousands of patients that come to our door, but we also accept thousands that come through. And how to package and get this message across has been an important challenge. This is part of this whole guilty business, and yet sometimes I feel that we are in a fishbowl. We are looked at from all around. Every little movement that we do is not only seen, but also seen magnified. So we've, and again, we'll go through some of this if required. And we have a bunch of collaborative educational and research programs that have helped us to maintain quality, to maintain our HR, to ensure that we remain at the cutting edge because, inherently we are in a field that moves every single year. Everything that you do today is out of date in a year or two as far as cancer or supportive care is concerned. All right, I think pretty much that's the end of it. Keep going, just a couple more slides. We've continued to invest in research, and here is another dilemma. Research could, of course, just be simple operational research or bench basic research and everything in between. And we've tried to invest into all of this because I think that for an organization like us, it is impossible to maintain and sustain your level of functioning unless you're actually doing all this. And so we've continued to do this. Right, next one, please. This has been a great success for us. Now, this was all homegrown. We created our own information platform, and today, almost everything we do, from the electronic health record to financial record to research to the institutional processes, from hiring to literally everything, is one single platform, homegrown within the institute. This is somewhat of a disruptive idea. Most people don't think you should be doing this, but it's actually worked for us, and it's really harnessed our ability to collect this data and to be able to come out with analyses for our own selves, and also to be able to answer any critics, because as you said, being in a fishbowl or being guilty as charged, you always need to be able to say, well, okay, this is where we are spending, this is our output, this is what we are doing. It helped us tremendously in our Joint Commission survey as well, and they were quite surprised as to how an organization in Pakistan, in a developing country, had this kind of technology platform to help it. All right, keep going, please. Yeah, I mean, I think this everyone knows here. So we do not let go of any opportunity for a free media placement. I mean, coverage. There are people who want to help. They're not going to give you money, but the fact is, they get coverage. The institution gains credibility, and I think it's tremendously important. We have a fundraising strategy which we can talk about, but that's really not the topic here. And keep going, please. I think we monitor our success or our progress, not just periodically, I think almost on a daily basis. We have this fund meter. It used to be called the fundo meter, and then people didn't like the word, and we dropped the O. But it's stuck. In the institutional lingo, it's stuck. People still call it the fundo meter. All right, keep going. And we, of course, analyze our efficiencies or lack of it in terms of fundraising and other areas as well. But, a lot of analytics is there. And usually we try remain less than 10% of the cost. I mean, of the total money raised, we spend less than 10% to raise it. Next one. And this is the WHO World Health Assembly, and it so happened that the president of the assembly was Pakistan's Federal Health Minister, Mr. Nasir Khan. This is from some years ago. So I'm grateful for your attention and for the invite.
Thank you, Dr. Saab. That was very interesting, and I think the part about the legal, which you hesitated to call quagmire, but it dovetails well with some of the stuff that was presented by Mahesh earlier. I think we should open this up to questions, and maybe then we can delve a little deeper into the research and both the experience that we've just heard from. So if anyone has any questions, I think now's the time to raise them.
Thanks very much. Both of the presentations were very interesting, and I think it will be nice to see how they connect in the discussion. So on that note, I'm interested in thoughts from both of you about non-profit or third sector service delivery and how it relates to government service delivery. So in the example of Shaukat Khanum, one thing I find myself wondering when seeing kind of the standard of care that's provided is, what can be learned by other hospitals and government hospitals? Is there any interest from the government or from other private sector hospitals in learning from and adapting the quality of that model? Because Shaukat Khanum won't do all of the healthcare in Pakistan. And similarly, Mahesh, in the I don't know if this is an aspect of what you're doing. I mean, the focus, I think, of the index is about the state as providing a facilitating environment for the third sector service delivery, but is this an aspect that you're thinking about as well? Is the third sector letting the government off the hook for providing services? Are there complementarities between the two where together they're achieving kind of more? Is there substitution, et cetera?
Yeah, so there's endless interest. We get constant calls, emails, requests, visits for that little magic potion, and I'm happy to share it. It's very easy. There's nothing terribly magical about it. And to bring a little bit more flesh and meat into it, people will come and say, okay, we want your SOP for this or that. And in fact, even zooming out a bit, how do you register? I'd estimate that on the average, I get a request once every week to 2 weeks, so maybe 30, 40 requests a year to help them navigate this whole process. Which rules, which law to register under, what shall we do, how shall we frame our rules, etc. So right from starting with a law and regulatory office down to more operational issues. Can we have your SOP for hiring? Can we have your information system? Yeah. Yes, please take it. So we've given it free of license cost to we offered it first to one of the large public sector hospitals here in this province. They were unable to really make use of it, but then we offered recently to 4 or 5 hospitals in the KP, and we've essentially given it away free and actually helping them in implementing some of this. So the ability to copy and use the model and expand is certainly there. Now, are we letting them off the hook? No, because the numbers are massive. I mean, if you just look at this, between 150 to 200,000 new cancer patients happen every year. So the incidence of cancer is 150,000 or 200,000, of which we are taking, say, 7 or 8,000 at this one hospital. So Peshawar fully functional will maybe take another that much. So Karachi another. So everything put together between these 3 hospitals will take in, say, 20,000 new cancer patients. It's still a fraction. So I think the government and as well as private and other non-profits need to step up to the plate just for cancer even, forget anything else. So I don't think we're letting them off the hook, but I think we are certainly helping them show the path and sharing our experience and absolutely anything that we have. The instructions within the institution are nothing is secret in this organization. They want a policy, they want an SOP, they want everything can be given right away.
Yeah, I'll echo that. I think the needs are just so massive that whoever wants to try and help should be encouraged to do that. And that includes the government, that includes private actors, that includes third sector, just absolutely anyone, just because the needs are so good. Also, the government has a unique advantage when it comes to scale. It's really unlikely that any other entity can replace government. And I think government in Pakistan and actually most large countries is aware of that. And I don't think the outsourcing of public service delivery is quite happening here. We have observed it happening in smaller countries. So for example, in Hong Kong, almost all the main hospitals are actually run by third sector organizations, but through procurement contracts. So in Hong Kong, government procurement from the private sector is how healthcare is provided. That is not how healthcare is provided in Pakistan and other large countries in Asia. So the government is not relinquishing its role. The government's role and its responsibility is not being, it's not being mitigated, it's being complemented. The needs are just far too great. So I think that will not happen in this part of the world. We've noticed another interesting trend though. We have noticed across the region an increased willingness by government to learn from the third sector and the private sector that maybe wasn't there even 20 years ago. So, and I think hopefully we'll do an article on this at some point, but we are observing that governments are actually increasingly paying private sector, and I'm including the third sector in this, but not only, but they're increasingly paying private sector organizations to come in and train government service delivery organizations. So we have noticed that trend in other parts of Asia. Pakistan, I can't speak to that.
For sure. I mean, just very recent and tangible. So I mentioned the tumor registry, the cancer registry that we set up in collaboration with organizations. Just last week, we had a visit from the Punjab Health Department asking whether what we had done, how we had done it, and they were exploring, and they asked very directly. They said, shall we do this ourselves? Shall we make our own, or shall we just add on to yours? And I said, well, my answer is obvious. The effort is made. Why don't you just add on? But if you wish to learn and copy it, here it is. This is how we did it. So I think that desire is there, and I think this two-way learning is definitely going to help. And scale, of course, only governments can scale. I mean.
Hello. It's okay. Okay, it's regarding. Thank you so much for the wonderful information both of you presented. In regards to the Doing Good Index, what proportion was allotted to each of the components that made up the index? And secondly, how was the public perception data about public perception collected? Because only the CEOs and the CFOs were involved in the survey, I suppose. Secondly, Dr. Faisal, regarding Shaukat Khanum, you were mentioning that when you train people, they have a tendency to leave, and that sort of affects the efficiency. What are you doing in regards to that? Are you thinking about automating or digitizing trainings to replace human resource requirements, or what are you doing towards that? I'm interested in that.
Okay, thanks. So we gave equal weight to regulations, tax and fiscal policy, and ecosystem. And we gave about 7% only to procurement. The remaining 93% is divided equally amongst the other three. Procurement is it's an additional tool. It's not large enough to get more than that, but otherwise it was a clean division between those three. So that's to address your first question. On the second one, public perception, we did not survey the public itself. We surveyed organizations and asked them a number of questions about perceptions, and then we aggregated those into different indicators that then fed into ecosystem mostly. So some of these questions were around, has your economy witnessed a front page newspaper covered scandal in the last 2 years? 10 out of 15 economies said yes. Even those economies in which scandals were older, such as China, I don't know if you guys are familiar with the Guomai Red Cross scandal in China. Not familiar. Guomai was someone who worked, well, that's because you've read the report. She was she was a contracted employee of the Red Cross. It's still murky whether she was or not, but she was. And she shared photographs of herself with her 2 babies on social media. One baby was, I think, a Lamborghini, and the other baby was a Ferrari. And when that happened, obviously the media erupted. And this happened, I want to say 2011, 12, it happened a few years ago. But Chinese NGOs are still reporting a drop in fundraising directly related to that. So we asked this question, an objective question. Then we asked a few subjective questions. Do you believe you are trusted by the community that you operate in? Most organizations said yes, and we actually think it's interesting to reconcile that to the national perception. The local perception seems to be very positive. It doesn't trickle up to the national perception. We also ask questions like, do you think that people believe whether non-profit employees should earn less than their for-profit counterparts? Overwhelming yes responses to that. So we asked them to report based on their experiences, society's perceptions, but we also asked them some objective, data-driven questions, and then we combined all of that.
Right. Thank you.
So HR loss, I mean, it's a fact of life. Wherever you are, you will lose trained resource. Now, the rate of loss and who you're losing to and what you're losing exactly is the bit that hurts at times. So some bit we can automate, some bit we can help to mitigate some of that loss. So you've trained somebody or a set of people in certain procedures, and they come in, and some of that training could be formulaic. Our problem is slightly different. It takes about 6 years for a physician to turn from MBBS doctor to an oncologist, for example, or any subspecialist. It's impossible to fast track it. It takes a while for these people to gain enough experience and capability. Similarly for nurses, similarly for other technical staff. So our strategies have focused on ensuring that we pay well. And this idea of, dovetailing your this idea of the non-profit not paying, well, we say, well, look, we are a great employer. We will pay as much as whatever it takes to hire a nurse, or to attract a nurse from the private sector or from the government sector. Interestingly, one very interesting dynamic is happening, and which is that because we are one of the most nurse-short countries in the world, I don't know if people know this, I think the only country that is more nurse-short on a population basis is Afghanistan. So our physicians, we are okay. We have got a reasonable number of physicians, but nurse-short. So what it's doing is driving up the price of holding on to a nurse. And so it's a very positive development for society at large, but creates these pressures for individual employers. So we say, look, we're going to be able to attract you from the public sector or from the private sector, and we need to be able to do it because of work environment, because of money, because of training opportunities, because of where you're going to go from this growth within your profession. hiring a little bit of extra people, and accepting the fact that you will have losses, especially amongst physicians, nurses, and certain technical fields like information systems. So just plan and cater for it. There's no other way.
Well, sir, I have seen Shaukat Khanum Hospital. I have seen that there is no single pharmacy specifically for oncology medicines. The patients, the poor cancer-stricken patients, have to go to outside to get their very expensive medicines. So why there is no any pharmacies of providing oncology medicine on subsidized rates in Shaukat Khanum, on subsidized rates?
I don't know what you're talking about.
I'm just talking. There should be a pharmacy for providing oncology drugs on a subsidized rate to for cancer-stricken patients.
For outside patients or for our own?
OPD patients. For OPD patients.
So, and I'm happy for your question to come through, but I think it's completely incorrect.
Yeah.
And what I'll tell you is that the hospital has a full range pharmaceutical service. The ultimate proof of this is that if you go to any other hospital in town, hospitals are surrounded by, why? Why? Because what's not available within, people are going to go and get from the outside. The surrounds of Shaukat Khanum probably doesn't have one pharmacy even, not one.
Yes.
I know it for a fact because every now and then if I need to get something that is not necessarily available in our pharmacy, I have to go about half a kilometer away. So we have a full service pharmacy that caters to every single thing, not just oncology, every single thing within the institution for our own patients. The difference is that the issue is, and perhaps that is where you're coming from, and I'm trying to understand where you might have sampled that issue, is that if you're coming from the outside in, we have a finite capability of providing you with a medicine. So for example, if we have a certain medicine which we imported or bought locally for our patients, and if it's in short supply, then we are very averse to giving it out, because otherwise then you run out of supply for your own medications. Now, in fact, if you bring in your own medication from outside, our nurses, physicians, and pharmacists are not automatically allowed to dispense that.
Thanks to the consortium for organizing a session on a subject which is not usually talked about in Pakistan. No question, but a comment for Shaukat Khanum, which is one of gratitude from the people of Pakistan for giving a global good practice. And I'm saying that with information, and thank you very much for that. To the gaps, yes, I've got a question, and the question is that being a research organization, are you looking today towards the need for, particularly in Asia, that we look at an impact-oriented philanthropy, which, and here I talk specifically, advances the Sustainable Development Goals, which we are all signatories to. And I'm saying this particularly in the context of Pakistan, because as we know, 70% of giving is given to charity and given by individuals, and only 30% of that is going to institutions and setups. And plus 1%, philanthropy in Pakistan is contributing 1% to the GDP. It's $2 billion annually, and I'm coming from the Pakistan Center for Philanthropy, the PCP, where we have, and I'm associated with it, and this is my interest in philanthropy. But I do think that there is great need for us to institutionalize sustainable development. And here I would leave you with the last thought, that Sustainable Development 17 is public-private partnership, and it goes back to what we have been hearing, that isn't it time for the private and the public sector to work together in Pakistan? And I would finally say that the PCP has got a strong research unit as well, and our flagships are research and the certification of NGOs, which you did mention. So we are the official government agency for certification as well. But on the research side, we very much are interested in working towards institutionalization and linking it with the SDGs. Thank you.
Thank you for that. And actually, we know PCP very well. It was one of our Pakistan partners. So PCP and STPI were the two partners who helped us collect the data for this. And in fact, this the Doing Good Index was one of the main presentations at the PCP Philanthropy Forum that was held in Islamabad earlier this year. I flew in for that as well. So, and I'm very aware of PCP and the great work that it's doing. You know, for certification, actually a couple of things. I'm interested in the 1% of GDP figure because we've looked for credible figures around the level of giving and how much of GDP that is, and we have not managed to actually find that for any country in the 15 that we look at. So I'm interested in the source for that, as well as institutional philanthropy versus charitable. This is why reporting is so important. It's very difficult to get at levels of giving, how they are diverted, because there is very little reporting that goes on. So in the US, for example, all charitable organizations are registered as 501(c)s. Their financials are available every year, should you wish. You can inquire through the Freedom of Information Act, and you can get access to any organization's financials, which is why we know that the US is actually one of the most giving countries in the world, with 2% of its GDP. The level of giving is up to 2% of its GDP. And we did some math and realized that if across these 15 countries, economies that we look at, if people were to give up to 2% of GDP, that comes to about $506 billion a year, which is 1/3 the annual cost of achieving the Sustainable Development Goals by 2030. So we're speaking big resources if this infrastructure can be set in place. So, you know, it's not small change that we're talking about. So if Pakistan is at 1% of GDP, I'm impressed, but I would want to investigate that figure. On institutionalization, public-private partnership, I think one of the encouraging winds of change is that there is a lot going on in this sphere. In fact, I would say public-private partnership is not, it's a relatively newer term. It's not a new phenomenon. In Asia or in Pakistan, actually. Philanthropy, which is institutional giving, is also not a new phenomenon. We have the Gangaram Hospital. We have all these amazing, examples of institutional giving. It's just that enough of that is not happening. It seems to have petered off. But again, can I back that up with numbers? No, because there's no data out there. One of the things we're trying to do is create that data. On whether we are doing research that actually directly speaks to impact oriented giving and investments, absolutely. The Doing Good Index is policy research, but like I mentioned, we also do applied research, and we have an applied report ready, which has not been released yet, which is on the impact of scholarships for higher education. That's our first one, which everyone gives scholarships, including Princeton, Harvard, all of the institutions that you mentioned over there. There is virtually, I can say this on record, no research, academic or otherwise, on what the impact of these scholarships is. So we're kickstarting that conversation, and we have found that the impact is far beyond the individual. The community is impacted, the family is impacted, the country is impacted, and we've tried to add numbers where we could. And our forthcoming applied research project is on social enterprises, because we feel that social enterprises are an up-and-coming piece of this, all the actors that are needed to actually achieve the SDGs and achieve development. So not just NGOs, not just government, not just companies, but also social enterprises. So our next piece is on that. And in fact, our applied research covers a subset of Asia. For the policy research, we cover as much as we can. For the social enterprises piece, the country that we are covering from South Asia is actually Pakistan. So we're hoping that we will create data that we can then discuss and talk about. So absolutely.
We have time for two more questions before we wrap up. Gentleman here and then the lady. That's
Hi, my name is Salim. Thank you for this wonderful talk. I wanted to inquire to what extent is the ease of giving philanthropy correlated with actual philanthropy per person in a country? And like, to what extent could a residual be associated with different cultural or religious differences between countries?
That's a great question. I think it's safe to say, based on our research, we have a co-authored book by the founder of CAPS and a couple of my colleagues, which is called Pragmatic Philanthropy. There's a chapter in there, the second chapter. This is again available for free online on our website. The second chapter looks at the history of charitable giving in Asia. And to no one's surprise, we find that Asian countries, Asian societies have long been champions of giving, of charitable giving. It's not a new phenomenon at all. What is perhaps newer or has kind of tapered off and needs to be done again is philanthropic institutional giving and institutional investment. So when it comes to charitable giving, no problem in Asia. People are, I think it's a human impulse to want to help others. We're all decent human beings. We all want to help others. So charity will, I'll never say that Asians don't give. In fact, I think maybe even because of our, community-based, our community support systems, I don't want to go into the history of government, but community-based support systems essentially meant that people were giving a lot within their communities to support others, right? Correlation between giving and how well an economy does on our index, I'll just give you one example, which is Indonesia and Myanmar, which are bottom in our index because they do not have the infrastructure yet for philanthropic giving, top the World Giving Index, which asks 3 questions only. One of which is, have you volunteered in the last 3 months? The other one is, have you helped a stranger in the last 3 months? And the third one is, have you given money in the last 3 months? If you answer yes to any one of them, it's a yes overall. Indonesia and Myanmar do really well there because there's a lot of religious giving in those societies. In Myanmar, it's a Buddhist society. You leave your home, there's a monk on the corner, you give to the corner. In Indonesia, there's a lot of religious giving. In Pakistan, there's a lot of religious giving. And we can separately talk about religious giving, sometimes crowding out giving to other causes. I was happy to see that Shaukat Khanum actually receives a lot of religious giving. It's not that true, say in Malaysia or Indonesia, where religious giving kind of disappears into organizations that have no accountability. But countries can do very well in terms of giving, and they can do poorly on our index, because our index is about the systematic infrastructure that encourages giving and encourages receipt of those donations.
I haven't looked at it relatively recently, but even in the US, religious giving far outstripped any other vehicle. I don't know if it's true as even now.
Crowds out
Yeah,
into
crowds,
other
yeah.
causes. And there's no accountability.
And about the ease of giving, I mean, I can give you numbers, but I can give you anecdotes. The number of times that people are willing to part with money, which runs in the millions, and I mean dollars, which they are not willing to be taxed on or to be documented, is just unbelievable. But, it's not that they're not willing to part; they'll give it away, but they will give it away in their own way or to their own preferred. So I think the vehicle or ease of availability of that vehicle does matter, and I think, with things like PCP, etc., people have learned how to be a little bit more organized and how to set themselves up for program delivery, for financial transparency. You do these 2 things and people will give.
So you were talking about how people are inclined to always give, and it's in our nature, but when we talk about corporate philanthropy, do you think that the intention, or were you able to actually look at it, what the intention is? Because in many instances, I work with a non-profit as well. It's called Medicare Health Foundation. So I've realized that so many corporate organizations are out there to promote their own agenda, push their own product, and not exactly do philanthropy. I don't want to take a name. There is one in mind, but or even sir, have you, in your experience, had the chance to observe whether corporates are actually, their intention behind giving, is it really to, out of that love to serve humanity, or is some other, some other thought at the back of their mind? Yeah.
I think my approach is very utilitarian in this. If they're giving, for whatever reason they're giving, let them keep giving, and in fact, put in incentives that will encourage them to give even more. So I'm less bothered by why they're giving, as long as they are giving. Having said that, if I don't know as much about, I think Pakistan mirrors India in this. The reason that the Indian government set in place the 2% CSR law is precisely because homegrown organizations, which is the bulk of the business sector in India and in Pakistan, don't give much. Whereas multinationals, which have exposure to giving and even using PR in their communities, etc., tend to give more or more systematically. So the Indian government recognized this gap and put that law in place. I have heard, but I'll need someone to verify this, that the energy sector in Pakistan has a self-imposed 1% CSR, which is great. It's great. And in Malaysia as well, CIMB recently announced again a self-imposed 1% CSR. So savvy businesses are jumping on to the goodwill and value of this kind of giving. And if that's their motivation, great. Whatever the motivation is, as long as they're giving, it's great.
Energy and telecom, I think these are the two sectors in Pakistan that have set this. I don't know, I think it's impossible to measure intentions even if you were interested in. I mean, first, by and large, as receivers of largesse, I am not too concerned about the intent, so long as they don't try to mess with our program delivery. And I think that's where we do draw a line and we say, okay, this is what we are going to do. I think very anecdotally that yes, more formal organizations are more structured to doing that. But I think even the informal ones do really wish to give. They give it as they are structured, which is informally.
What I was trying to get at was that sometimes under the guise of, doing CSR, they're actually just pushing their own products, not really so monetarily donating to an organization. They'd rather be like, we're running advocacy programs. And at the end of the day, when you look back at it, it's more about trying to push their own product.
So we've experienced this, to be honest, we have. And one has to see what they are really selling. And where do you wish to really lend your name to, and should you? And should it be something which is even fair or reasonable, or even whether the product is something that ought to be sold without naming? For example, fast food of a certain brand, we didn't want to associate. Now, to us, the problem, it's not that we are against fast food, and fine, fast food is a fact of life. A lot of young people eat a lot of fast food. But we do feel that as a healthcare organization, especially that's working in cancer, we should not necessarily be promoting something that's heavy in fat content and likely to perhaps promote cancer. Certainly, more black and white would be tobacco. We just wouldn't do it. On the other hand, we were presented with an interesting dilemma that during Ramzan, a lot of restaurants donate a certain proportion to. Now, Ramzan is the time when we do raise money, and we do want our profile high at that time. So the same organization that had contacted us for a normal during the year kind of campaign, and we said no, and they were kind of slightly hurt. But when it came to Ramzan and they came and we said okay, they were kind of surprised at our thing. And our logic was, look, during Ramzan we are allowing other restaurants to part with some of their profits for SKM. It wouldn't make sense to now at this point exclude, because as is what we end up eating in Ramzan, as is high in fat anyway. So some of it is very judgmental and that way. But yes, we are a little bit careful in what we are partnering with. By and large, I don't like this co-branded business because, of course, as you said, they're selling their wares and.
Thank you all for being here, and lots of gratitude to both Mevish and Dr. Saab. This was a very interesting discussion, and we were very pleased that we were able to put this together and that both of you could come here. Thank you once again. There are refreshments outside, so.
I have a few copies.